Hi everyone, my name is Tiffany Lamb and I am in Miss Berlin's section, and today I'm going to be talking to y'all about general versus local anesthesia and the issues that we have with them in the perioperative setting. So what is general anesthesia? General anesthesia is a mixture of certain medications that puts a person in a completely unconscious sleep-like state where they are unable to feel any pain. It's generally used for procedures that take a long time or for procedures that affect breathing, such as a chest or upper abdominal surgery. What is local anesthesia? Local anesthesia is meant to numb a certain part of a person's body, and this can come in an injection or a topical form. Some examples of procedures that use local anesthetics are skin biopsies, repairing a broken bone, or stitching up a deep cut. Some of these issues with anesthesias with both general and local will be discussed throughout the presentations, but the main one are safety, money, and recovery. Each surgery uses a different kind of anesthesia designed specifically for hopefully the best outcome. When coming up with solutions, I won't be able to resolve conflicts for specific kind of surgeries, but for general OR safety hazards that most surgeries have in common. So, issues that we have with general anesthesias. I got these issues from multiple articles, and these were the common points. So, with general anesthesia, you are at a higher risk factor for postoperative MIs, unplanned intubations, and pulmonary resuscitation procedures. Um, Observational studies also suggest that general anesthesia during endovascular therapy is associated with worse outcomes compared to conscious sedations. Um, General anesthesia is also associated with longer hospital stays. And it's also more expensive, and there's not a specific reason why general anesthesia is cheaper, but we think it's kind of like the butterfly effect. If there's a longer stay, it's going to cost more people, more equipment, and therefore more money. And I know I stated a lot of cons of general anesthesias, but there are pros too, otherwise we wouldn't use them. For example, in the article Local versus General Anesthesia for Transcatheter Aortic Valve Implantation, Systemic Review Meta-Analysis, they state that general anesthesia provides more stable conditions by preventing the patient from moving, especially during a detail-oriented procedure. Now, issues with local anesthesia. We're going to be talking about the common ones. So, you have a stressful conversion of regional into general anesthesia if anything goes wrong, local anesthetic toxicity, and local anesthesia is not tightly controlled. But pros to local anesthesia are it's a golden standard of cerebral functioning monitoring. It reduces cardiac and respiratory related morbidity. It's shorter hospital stays. It's lower cost. Better postoperative analgesia than systemic opioid techniques. It reduces blood loss, and there are a lower risk of blood clots. And if you notice, there are a lot more pros in local anesthesia. And because of that, I am proposing that we use more of monitored anesthesia care. Now, what is it? It's local anesthesia combined with sedation. It's a combination of systemic sedatives and analgesics. So, why is it better? Sedation during MAC is considered safer because it uses a lot less drugs than general anesthesia, and it's very cost effective, and there is a rapid recovery. Now, what are the pros and cons? Pros are that it has fewer side effects, and like I've stated, it's shorter procedure time. And cons, common injury deriving from respiratory compromise from oversedation. And so, because of that, we always have the anesthesiologist pay really close attention to the patient whenever they're using MAC. But some may say that that is a pro because with the anesthesiologist paying more attention, less likely something bad will happen because they're being closely monitored. And other solutions, always educate. You can always have a seminar for nurses to figure out what the side effects are for analgesia. For anesthetics. So they are able to closely monitor and pay attention for it and have their eye out for those side effects. Summary. So, with general anesthesia, there are some procedures that you can't help but use general anesthesias. There's no way around it. But if there is a safer option, why don't we use that? Medicine is constantly changing and making innovations to have safer outcomes. Monitored anesthesia care is a way for healthcare providers to potentially have a better outcome for surgeries, during surgeries, and after. And these are my references.